Well, the movement has wrapped up as of right now. There's still a few tents that are just being taken down, but we saw hundreds of Kaiser employees going around the streets, but it wasn't just the employees out here. We also saw some patients that were joining in on the strike, and when we spoke to them, they said that although they do feel that it is unfortunate that a lot of services and appointments were canceled as a result of these strikes, they are still in support of the movement.
Put patients first.
Hundreds of Kaiser Hospital employees and supporters held a strike outside the hospital on Dale Road, calling for improved patient care and labor practices, according to some staff.
For a lot of us, especially for me and my modality, it's not necessarily about the pay. It is 100% backed by patient care.
But employees weren't the only ones in the picket lines.
It takes a long time to get to be seen.
Longtime Kaiser patient Omar Jackson is living with a heart condition and says he decided to join the strike after facing some challenges with his own health care.
The wait times are longer now than they have ever been, and I have been to almost all the Kaiser hospitals from the Bay Area to out here in the Central Valley, and it's the same thing no matter where you go.
For Jackson, there is one solution.
They deserve to have the proper amount of staffing so it can help us as patients and them as workers.
But while the strike goes on, many services have been interrupted, with some doctors and nurses carrying on critical emergency services inside.
Difficult situation.
Homer Garza, another Kaiser patient, says that while he feels for those who have had their appointments canceled or rescheduled due to the strike,
usually when these people do what they're supposed to do, they have better care in there. And many have patients in there that need things, and there's no one there to help them.
He is in support of the employees and the movement.
Well, I really believe that they should negotiate with people. That way,
Patients first.
they wouldn't have to have strikes.
Put patients first.
Now, in a statement, Kaiser said that the impact of these strikes is different from location to location where they're happening, but they don't want that to discourage patients. They say that if anybody out there still needs emergency or urgent care services, they should seek out their local facilities. For now, reporting live in Modesto, Josie Hart, KCRA 3 News.